Hi, my name is Francesca Moisson, and my faculty mentor on this project was Dr. Dall, and our project was called Glycocalyx Production Aids Antibiotic Resistance in Pharyngeal Isolates.
For introduction, pharyngitis, otherwise known as strep throat, is most often caused by Streptococcus pyogenes, and it affects approximately 11 million people in the United States each year. A previous study we completed demonstrated that Streptococcus pyogenes produces a glycocalyx and may have a role in bacterial pathogenicity and protection in oral pharyngeal infections and skin and soft tissue infections. The purpose of this study was to investigate glycocalyx production in beta-lactam susceptible isolates of pharyngeal infections. Given these are early findings, we plan to generalize these results and investigate these topics more fully.
Methods: 24 isolates of oral pharyngeal infections, 7 of which were refractory to treatment, and 17 were susceptible to treatment, from the Medical College of Wisconsin and University of California, San Francisco, were collected from patients to determine glycocalyx production utilizing a well-established assay known as the tryptophan assay, which was developed by Shetler et al. These measurements were then evaluated to determine if there was a statistically significant difference between these isolate categories. Moving on to results, as you can see in our graph, absorbance in pharyngeal and refractory pharyngeal isolates. Absorbance is on our y-axis, and on our x-axis, we have pharyngitis in blue and refractory pharyngitis in red. You can see there's an increased absorbance in refractory pharyngitis. In the small number of isolates used, a statistically significant difference in glycocalyx production was found between pharyngeal and refractory pharyngeal isolates utilizing the student's t-test, which produced a p-value of less than 0.05.
The purpose of this figure is to illustrate the glycocalyx, which we are talking about in this poster. So this is a transmission electron micrograph of a member of the viridin streptococci group. And so the arrows are pointing to the glycocalyx surrounding the bacterium. In conclusion, these are early findings. However, they do suggest there is an association between glycocalyx production and bacterial pathogenicity. You could postulate that glycocalyx may protect an organism from antibiotic treatment, and the organisms which produce more glycocalyx may result in resistance, as seen in this study. Furthermore, the isolates were beta-lactam sensitive, and that Streptococcus pyogenes persisted despite beta-lactam sensitivity. In the setting of persistence despite therapy, one could hypothesize that glycocalyx may retard sterilization despite susceptibilities, thus necessitating a treatment which will penetrate the glycocalyx more successfully. Thank you for your time.